Most retirement channels will tell you that living on Social Security alone is basically a disaster waiting to happen. They're not entirely wrong, but they're leaving out the most important part of the story. There is a completely legal strategy hiding in plain sight that almost nobody explains clearly. It's called filling your tax brackets with small, deliberate Roth conversions during your lowest income years. Done correctly, it can let you walk away from work years earlier than you thought possible. And it can protect a modest Social Security check from being eaten alive by future taxes. Today, we are mapping out the exact math behind a real low-income early retirement plan. Every number you're about to hear reflects official 2026 rules from the IRS and Social Security Administration. By the end, you'll understand exactly how these two systems can work together in your favor. Stick around, because the middle of this video covers the one mistake that ruins this entire strategy. Let's be honest about something first. Social Security alone is not designed to fund a lavish retirement. The average retired worker collects a little over $2,000 a month in 2026. Someone who claims early, at age 62, typically collects far less, often closer to $1,400 a month. That's roughly $16,800 a year before any taxes are considered. For most people, that number alone sounds terrifying. But here's what most retirement content misses completely. The years before you claim Social Security and before you turn 65 are financially unique. During those years, your taxable income can be almost zero, even if you have substantial savings. And that narrow window is where this entire strategy lives. Financial planners sometimes call this period the gap years. It's the stretch between quitting full-time work and either claiming Social Security or reaching Medicare eligibility at 65. Picture someone named Alex, who leaves a demanding job at 58 with a modest retirement account. Alex plans to claim Social Security at 62, expecting roughly $1,400 a month. Until then, Alex has almost no reportable taxable income at all. There's no paycheck, no pension, and no Social Security check yet. That absence of income is not a problem to fix. It is actually the single biggest financial opportunity in Alex's entire retirement. Here's why that empty income space matters so much. In 2026, a single filer gets a standard deduction of $16,100. That means the first $16,100 of income is completely tax-free. After that, the 10% bracket covers income up to $12,400. Then the 12% bracket stretches all the way up to $50,400. So in a true zero-income year, Alex could convert money from a traditional retirement account into a Roth account. And a conversion of around $50,000 could be taxed at a blended rate under 12%. Compare that to waiting until required withdrawals begin later in life, often at a much higher tax rate. This is the core move. Shift money now, while the tax cost is nearly as low as it will ever be. Financial writers sometimes call small, repeated versions of this a Micro-Roth conversion strategy. Not because the dollar amounts are tiny, but because each conversion is deliberately kept inside a low bracket. Let's put real numbers on this. Suppose Alex converts $34,300 from a traditional account into a Roth account during a year with no other taxable income. The standard deduction absorbs the first $16,100, leaving $18,200 of taxable income. The 10% bracket covers $12,400 of that amount, creating a tax bill of $1,240. The remaining $5,800 falls into the 12% bracket, adding another $696. Alex's total federal tax bill comes to roughly $1,936 on a $34,300 conversion. That works out to an effective rate under 6% on money that will never be taxed again for the rest of Alex's life. Now here's the part almost nobody explains well. Converting one enormous amount in a single year sounds efficient, but it usually backfires. Two specific tripwires punish large one-time income spikes, and both connect directly to this strategy. The first tripwire involves how Social Security itself gets taxed. The IRS uses something called combined income, which adds your regular income to half of your Social Security benefit. For a single filer, once that combined income passes $25,000, up to half of your benefit becomes taxable. Past $34,000, Up to 85% of your benefit can become taxable. Those thresholds have not been adjusted for inflation since 1983. A single large Roth conversion in the same year you're collecting Social Security can trigger this instantly. The second tripwire is health insurance. Enhanced Affordable Care Act subsidies expired at the start of 2026, and the old subsidy cliff is back. In 2026, a single person loses all marketplace subsidies the moment income crosses about $62,600. One oversized Roth conversion in the wrong year could push you straight over that cliff. That single mistake could cost thousands of dollars in lost health insurance help. This is exactly why the strategy works best as many small conversions, spread across many low-income years, rather than one dramatic move. Here's where the strategy quietly pays off for decades. Money inside a Roth account grows completely tax-free for the rest of your life. Qualified withdrawals from a Roth account are not counted in that combined income formula at all. They also don't count toward the income measured for Affordable Care Act subsidies. And unlike a traditional retirement account, Roth IRAs never force required withdrawals during your lifetime. So every dollar moved into a Roth account during these low-income years becomes permanently invisible to two of retirement's biggest tax traps. That's the real synergy here, and it's not a secret loophole. It's simply patient, deliberate tax planning that most people never get around to doing. Before you get too excited, let's talk about the actual risk. Health coverage before age 65 is the single biggest threat to this entire plan. Without employer insurance, most early retirees rely on the Affordable Care Act marketplace. And every dollar of Roth conversion income can shrink your subsidy or eliminate it completely. In states that expanded Medicaid, very low income can qualify you for free or low-cost coverage instead. In states that didn't expand Medicaid, falling below the poverty line can leave you in a dangerous coverage gap. This means your Roth conversion strategy has to be planned around your specific state's rules, not just federal tax brackets. Skipping this step is the single most common way this entire strategy falls apart in real life. So how do you actually build this for yourself? Start by estimating your Social Security benefit at your planned claiming age using the SSA's own calculator. Next, map out your gap years, meaning every year between leaving work and claiming benefits or turning 65. For each of those years, estimate your total taxable income with no conversions at all. Then calculate how much room remains before you hit the top of the 12% bracket. That remaining room is roughly how much you can convert that year without overpaying in taxes. Finally, check that amount against your state's Affordable Care Act or Medicaid income limits before you convert anything. This isn't a strategy you set once and forget. It's a plan you revisit every single year based on your actual numbers. None of this replaces a conversation with a qualified tax professional who knows your full situation. But now you understand the mechanics that most retirement content leaves out entirely. If this changed how you think about your own gap years, tell me your planned retirement age in the comments. I want to know how many gap years you're working with. Subscribe for more deep dives into the real math behind early retirement, taxes, and Social Security. Thanks for watching, and I'll see you in the next one.